Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube. Also, you'll be able to support us here on our YouTube channel by hitting that like and subscribe button. And also, as a gift for you for subscribing to our channel, you can hit the link down below in order to download a free healthy meal recipe that we do have here on DamiRx Care. Thank you and bye-bye. Our medication of choice today. Our medication of choice today is known as Ozempic or Rybelsus. So it's known as a generic called Semaglutide. So this medication is mostly used in patients who have type 2 diabetes, as well as patients who are obese, and also patients who have a condition known as non-alcoholic steatohepatitis, which is also known as non-alcoholic fatty liver condition. All right, so how is this medication taken? So this medication is taken for the subcutaneous medication, which will be Ozempic. It's taken as a 0.25 milligrams subcutaneously once a week. And then you can go up to 0.5 milligrams subcutaneously once a week. And you can go up from there to about 1 milligram once a week. So subcutaneously means under the skin. So you're putting it kind of under, your skin layer. All right, so what are some side effects of this medication? So some side effect of this medication includes nausea as well as vomiting. This medication can cause diarrhea. It can also cause abdominal pain as well as increased appetite. It can cause constipation. It can also cause redness, itching, bump, swelling, or changes in the area of the skin whereby this injection is being placed. So what are some serious side effects that are attributed to this medication that you definitely want to reach out to your doctor or stop the medication in order to get evaluated by your doctor for? All right, so in patients who have a history of a thyroid cancer, this medication would not be recommended, as this medication can cause increased risk for thyroid tumor. Also, in patients who have a history of pancreatitis, this medication will also not be recommended, as this medication can cause swelling of the pancreas. Also, in terms of patients who have issues, maybe like gallbladder problems, this medication would not be recommended because it can cause some gallstones or swelling of the gallbladder area. So this medication can also cause low blood sugar, so you definitely want to make sure that you're aware of the low blood sugar that occur in patients who have diabetes. That way, once you start having those symptoms, you're able to correct it immediately by taking something that has carbs in it in order to help offload that low blood sugar. Also, in terms of patients who are taking Ozempic or the Rybelsus, you want to make sure that you're taking note of any vision problems. So if you start noticing any eye issues, maybe like your eye pain or eye irritation, or you're not able to see well, then you definitely want to report that to your doctor. Also, if you start noticing any form of increased heart rate, these are definitely pointers to make sure that you're mentioning to your doctor in order to get evaluated. Also, in patients, they have also reported some side effects that include increased risk for depression or suicidal thoughts. If you start noticing those, make sure, like I said, reporting to your doctor. That way they can evaluate and make sure that it is not because of this medication. All right, so in terms of taking this medication, how do you take it properly? So this medication is usually given as a shot underneath the skin, as I said earlier, and is given into maybe your stomach, your underarm, as well as your thigh area. So you want to inject this medication in areas where there are enough fat. That way this medication can penetrate properly, and also you'll be able to work as prescribed. Also, in terms of this medication, you want to make sure that you're staying well hydrated in order to prevent any form of renal failure or renal condition while you're taking this medication. Also, you most likely have heard this, if you do have if you are taking it for the type 2 diabetes, then you definitely want to make sure that you're watching out for your low blood sugar symptoms. That way you're taking remedies or carbs that help relieve this low blood sugar symptoms. In terms of oral tablets, you want to take that medication at least 30 minutes before your first food or beverage or any other like oral medication. That way you can kind of give it more time to work. Also, you don't want to take it with any water more than 4 ounces. So you want to make sure you're taking it with no more than 4 ounces of plain water only. And in terms of the tablet, make sure you're not splitting, chewing, or crushing this tablet. Make sure you're taking it as a whole tablet followed by, water. Also, you want to make sure that if you are using the subcutaneous injection, you want to administer that subcutaneous injection at the same day each week in order to stay consistent with this medication and also for it to be effective. If you are taking other insulin products, it's recommended that you administer those separately from the Ozempic injection. So you can apply it, you can inject it in the same area, but you don't want to apply it too closer to each other or anything adjacent to that area where you've just injected your Ozempic or where you've just injected your insulin. So you want to make sure that you're spreading it out as much as you can. You can apply it to you can inject both on your stomach, but just make sure that you're giving them more space apart. All right. And also in terms of the Ozempic pens, make sure you're not sharing pens with other patients. Even if the needle is changed, it's recommended that you get your own pen and inject your own injection pen as prescribed by your doctor. All right, and this is usually done in order to prevent any sharp related injury or transmission of disease through bloodborne disease that can be passed on from one patient to another when they share injections or sharp objects. All right, I hope I was able to help in terms of what to look out for while you're taking this medication. If you did enjoy this video, make sure you give it a like, subscribe, or a thumbs up while you're here, and we'll look forward to seeing more of you here at Demi RX Care. Thank you and stay blessed.